Step by step, we'll light the way.
Doctor, remind the audience, you have how many years that you've been treating cancer patients?
So yeah, I've been in practice since 1999, and so almost 27 years. And in those years, more than 20, probably closer to 25 years, I've been doing more strictly cancer care. So yeah, I've been doing it breakfast, lunch, and dinner for over 20 years.
The and I speak with cancer patients all across the country and in Canada, and then help set those patients up with the right facility. One question that I'm asked quite often are, what are going to be the side effects or likely side effects of chemotherapy uh, if they decided they wanted to go through chemotherapy? Are there some ways that they could mitigate the side effects with it on an integrative and natural basis? And then also, I'm also asked what the length of, how long could some of these chemo side effects last? So, and how could they go about mitigating some of those
Sure.
side effects, or even enhancing the chemotherapy to get more use out of it, if that could even possibly be done on an integrated basis.
Okay. Yeah, so there's a lot of meat in that question.
Mm.
So let me do my best to try to answer. So first of all, in regards to chemotherapy, not all of them are the same. So there are some that are more harsher than others, and some, believe it or not, that are, not as hard. Uh, Usually the side effect with some patients tend to bring up a lot is if they have hair, it's like their hair falling out, and with certain chemotherapy programs. So there are some that do that, but there are actually some that don't, or they may be thin that. So it all depends, and and sometimes there's like maybe one or two drugs, and sometimes there's a cocktail. And then remember too, like that term chemotherapy is there's I think there's an older definition of that word and there's a newer definition. And so the older definition is like the older drugs that were more harder, that the older the chemo drugs, like say, like oxaliplatinum or cisplatinum, or the 5-FU or the taxanes or adriamycin, those things. But now they're starting to lump even other drugs that would be considered not so much chemotherapy, but they're a different type of drug. And so I think that definition could have many thoughts to the consumer. Versus from an oncology side, it's like, well, there's drugs that don't are not the old school definition, that are not as hard.
Okay.
So I just want people to kind of to know that when you say the word chemotherapy, it's like, so basically the older definition was anything that kills cancer cells, right?
Okay.
And now you're getting into like targeted drugs, that can kill cancer cells, that are quite gentle. You have hormone treatment that could put cancer cells to sleep, and those could be more, more gentle depending how strong they are. So,
Okay.
but anyways, I just want people to know that yes, there are some chemotherapy programs and regimens that are harder. Like let's look at, for example, breast cancer. Classically, there's three drugs that are commonly used in breast cancer management, like say for those in curative conditions where it's like a doxorubicin, like a taxane, like say paclitaxel, and so like cyclophosphamide, for example. And so those ones are you would call older drugs, and the ones that could cause nausea and vomiting and can cause hair loss, right? And but say when you're looking at, say, someone going through treatment for colorectal cancer, and say the classic drugs that are used called, say, Folfox, as an example, or Folfuri, those don't really need to so much hair loss, and but they have other side effects. So I just want people to know that yes, there are some cocktails that are harder and some that are not as hard.
Okay.
And some drugs that could, say, cause, for example, hair loss that people don't like if you have hair, especially women really talk about that a lot as well, versus others that do not. And then when you talk about side effects, those are obviously things that could be long lasting for some people. So when we talk about breast cancer, I was talking to a patient yesterday where one of the drugs that she received with for advanced breast cancer, it's HER2 positive, she received this taxane, paclitaxel, and 5 years later, she still has
Wow.
numbness in her feet. So not as much in the hands, and you know why? Is because there's sometimes a treatment you could do where you actually put on this cold gloves, right?
Okay.
And what the cold does, it decreases the circulation, say, into your hands. When you get the chemo given,
Right.
IV, less is going where you don't want it to go in the hands, right?
Okay.
And but guess where they didn't give it to her? On her feet. You can get these cold. It's called cryotherapy or cold treatment.
Hmm.
And that's where you're also hearing in some women where they put this cold cap
Right.
on the head. Similar idea.
Okay.
Now they're even starting to use, for example, compression, like where you're actually putting really tight gloves, like tight
Okay.
surgical gloves, and that's another thing that's being talked about. So and so some side effects could be real, and sometimes could be longer lasting, yes. And that's why they talk about, sometimes about this new normal, for people after treatment. And this is where I think when you talk about the bigger picture about, like, well, what could integrative medicine do? What could incorporating like tools and modalities do to help people?
Okay.
So my thing, what I've come to realize in my years of practice is the sooner people could see an integrative doctor, integrative physician, naturopathic physician, naturopathic oncologist, etc., I find those people fare the storms better.
Okay.
And if they are getting hit with symptoms and treatments, in our experience, they tend to be not as longer lasting,
Okay.
So and why is because you're trying to help them out. You're
Okay.
trying to support them. And you're trying to make them that their body is more resilient. You're supporting them so that they can handle these waves and these storms better.
Right.
And that's been our experience. And some oncologists who are, I would say, more open-minded, and say those like, say, a medical oncologist where they really want to be more collaborative, guess one of the reasons why they sometimes would refer is that they could give more chemo.
Oh.
so so I know there's some people who don't want chemo, but on others who are doing, they want their best miles with it. There are some studies, say, in breast cancer where there is a cumulative dose they'd like to give, and if they can do that, potentially they could do better longer term. So anyways, and that's where we have some oncologists where they're like, could, by working together, and the people being more resilient and more supportive, that the oncologists can do what they need to do, and try to do things as to the fullness of the protocol that they
Okay.
possibly can. So, again, I'm not saying that's right for everybody, but I'm just letting you know. And so there's ways of being integrative, um, and where you could be better supporting a patient, and making sure they get the best mileage, the best of both worlds as
Okay.
best as they can. And which could also mean patients being more resilient to fulfill, like, say, the best they can from a treatment protocol. So this is what more, I guess, when I'm talking about those they call in the adjuvant setting with chemotherapy. And so what that basically means is, when they're giving chemotherapy in the adjuvant setting, is that they've done surgery, and so they're just given chemo to potentially mop things up or up the
Okay.
percentage points. Obviously, that's different though in patients that are more in the advanced disease, and you're more in this, I guess, longer maintenance program, which is a different scenario. However, but say you have a treatment that's working really, really well, and it's advanced disease and things are shrinking well, and sometimes you want them to be as, like, okay, let's really push this mileage as far as we can,
Right.
and giving this great room of response. And so, but yeah, anyways, there's a lot, as I said, there was a lot of meat in that question. But so I think, as I get, one of the take homes is not all chemotherapy programs are the same.
Right.
Not all of them are as toxic as what is perceived to be. And I'll give you another example of that I was just thinking with a patient I saw. He had the diagnosis of a brain cancer, glioblastoma, and there's a protocol that's given with chemotherapy and radiation, and the chemo arm of it is super gentle, you know.
Okay.
And then when radiation is done, then they give this maintenance of this chemo pill, like 5 days on, say 28 days off. And again, hair doesn't fall out, it's not so hard, generally speaking, and that's considered chemotherapy.
Okay.
And then you have someone else where their hair's falling out and they're getting mouth sores like crazy, and that's another version.
I'd say the biggest uh, complaint on side effects would either be, fatigue, or just wiped out fatigue, or not, or nausea. I would say that's probably a bigger complaint, where someone is going through the chemotherapy and having those symptoms, and they're calling me looking for, uh, a consult with a doctor to help mitigate, mitigate those side effects, or to get away from the chemotherapy entirely.
Yeah, and so I guess in terms of making things more simple, and thank you for those points, is that people just want to feel better, right?
Right.
And want to feel well again, and especially if they've been hit with treatment. So the one thing about chemotherapy is that it can be cumulative. So it's like someone punching your arm, eventually it's like, okay, I feel this.
Right.
And I think that was why I mentioned in the beginning that those who integrate earlier,
Okay.
they handle those storms better, meaning the fatigue could be better tolerated, and the nausea could actually be better, or sometimes not at all.
Okay.
And but there always are things that you can do to help people during those situations. And sometimes it's what you also just said, is that perhaps the chemotherapy for them is too strong, or it's too
Okay.
much. And this is something that I tell some patients, right? So is that the cancer is a part of you, right? So it comes from you. So if you're getting hit hard, there's also a chance that cancer is getting hit just as hard.
Okay.
Okay. So that's something to think about. And,
Okay.
and sometimes too, the chemo is too strong, too much, or maybe it's not just working right for them. And so like for example, again, I might be a bit biased, but that's where I sometimes giving those the IV nutrition in people. Like you bypass the gut, the stomach, and you just put things more into the blood,
Right.
and you're just nourishing them in a way that's different, right? And for those who can receive that. Um, there's also like simple things like, there's this amino acid, like, and it's called glutamine. Have you heard of
Okay.
that amino
I
acid?
have, yes.
Yeah. Your body makes it actually every day, and it makes 60 to 80,000 milligrams per day. It makes a lot naturally. And there's been papers to show that it can help with chemotherapy side effects,
Okay.
radiation side effects. There's been some papers even with surgeries. Now, I know there's some talk and discussions about there's always controversies in medicine. And so I know there's been some discussions, oh, glutamine, can't that feed cancers? I hear about there's some doctors talking about that, just like sugar can. So all most of the human papers, what they're showing, it doesn't do that. When you
Okay.
look at a mouse paper, or a laboratory paper where you could breathe on it and it could like make things grow or shrink,
Right.
um, I always tell people, what's the greater evidence? What's in a human, or
Right.
what's in a mouse or in a petri dish, right?
Right.
And so I just want people to know that things that your body is making, and it fuels the muscles, the immune system, your tissues for wound healing. Those could be good things. And so again, that could be a very simple thing, that could help people, for example, feel better and
Right.
help with side effects. And there's many things too. Like obviously we know fundamentals, being active when you can, physical activity, good nutrition, juicing, like those are things that always go far. And
Okay.
but like anything, there are complexities with every case. And, there's obviously people who have like surgical procedures done, they have stents put in, they have, other complexities of other underlying medical conditions. And so you're always trying to home together this complexity and create a program that's unique for them.
Now I'm asked today. I was asked, what supplements should I be taking? And I said, well, you need to have a consult with the doctor. And they go, well, what would you suggest? And I said, well, the before getting on this huge regimen of all these different supplements, you probably ought to have a consult first, some testing to see what you do and do not need, the so that you're not having interactions with what you're already doing. Start with that consult, get some testing so that you're not spending money unnecessarily. You some of those IVs may be you may be spending less in some IV therapy than the big box of supplements that you're getting down at the grocery store.
Yeah, like it's you bring up a great point. Like I was at an event over the weekend, and then someone was just saying, "What do you do?" And I said, "Oncology could be very complicated and complex, and sometimes it's simpler, yes, but there could be intricacies at what you've mentioned when you do a consult and a visit. You're able to look and home in on these details. So, for example, if you're in pain, right, and you have cancer, that pain will interfere with your ability to eat, to
Right,
sleep, to do anything.
right,
And you might have this great idea of supplements or other approaches to help somebody, but if you're not addressing that pain in that person, all these other things are not going to work well, you know?
correct. biggest high in the world is being in extreme pain and then out of it.
Yeah, that's right.
There's, stuff,
Like,
there's nothing better.
that's right. Like I remember one time I had a bad tooth. I was like, take me now, you know? And that's what I mean. So these addressing these other factors that people are dealing with, you have to prioritize things.
Right.
And so as you've mentioned earlier, if someone's nauseated, but you want to give them this anti-cancer protocol, it's like, well, you have to try to improve that. But here's the thing that people forget. There's been some research years ago to show this that kind of jolted I guess the standard oncology system when it was released. When you improve quality of life, you could actually improve their survival.
Right. I think
And
so too.
and that's what people seem to forget. And in these papers, you know what they showed? When you improve their quality, they needed less chemotherapy
Mm,
and they had a longer survival. So that was actually originally done in lung cancer many years ago. And so that's where addressing these other factors that you had mentioned is important. And when you do all that, then you can throw in these other tools and modalities and try to customize it to that person. And then what you will tend to see when you address these variables, the outcomes will be better.
excellent. And on my website, there's a laundry list of treatments and definitions and case studies and, for patients to look at. And they go, so which ones are for me? Which ones are the doctor going to recommend? I go, you're going to start with that. You're going to have to start with that consult. Everything's going to be individualized and including dosages, and taking a look at things like the nausea, the pain levels, those things have to be, the doctor's going to have to, address those because, if you're in extreme pain, then, a lot of this other isn't going to get better if that person is, in such pain. So start with that consult.
Yeah, and then you would go from there. But like as I said, there's always things that you could do to try to help somebody. And the key in being what healthcare providers do, the ones who kind of probably have more experience in these areas, they home in all these things and try to customize it to that person.
Right.
And then by doing so, you'll have better outcomes regardless. And so sometimes when some people are coming in, I really want them to take this one thing, or I really want them to do this one treatment. I was like, okay, but I'm going, as you've mentioned, they're like they're not, they have no appetite. They have chronic diarrhea. They have these other issues. And so what bang for their buck are they going to get from that?
Right.
At this
Right.
point in time. And so let's work on a multi-prong approach to address all these things so that you can then incorporate these other interesting tools into the program.
Oh, and excellent. And I'm sure that patients that I'm speaking with, when they're watching this video, they'll be able to get some hope out of the video. That's the purpose, so that you can realize that, hey, it doesn't have to be a one size fits all for you, right? You don't have to be crammed into one particular box of treatment. That there's some other options that are out there. And if you can get started with an integrative doctor in conjunction, or it could be instead of, but even in conjunction, it's just increase. It seems to be increasing the odds of success for that particular patient.
I would agree with you, right? And there's always hope. That's what I've learned. And there was this senior medical oncologist that I had the privilege of collaborating with for majority of my career. So he's one of those types that practiced till his 80s.
Okay.
And he was open-minded, so he's dealing with people like me, for example, right?
Right.
And, he would always say, he goes, in his long years of practice, he goes, you just never know. And when people would say, do miracles do happen? He goes, yes, they do. And, uh, and I remember he actually had a patient that we were treating, or actually, he actually said that to him. He had this dramatic shrinkage of this non-Hodgkin's lymphoma, and it was one of these harder to treat. It became more aggressive. He made a few changes and interventions, and these lymph nodes shrank. And he goes, "Wow, miracles do happen."
Right.
So there's
Right.
always hope, right? And
Right.
and sometimes you have to keep searching to finding the right people, the right team. But and why supporting the body is also so important is because if your body starts going down, right, then it's harder to help them, right?
Right.
And so it just takes more. And so that's why I always emphasize, don't wait too long, you know,
I would.
like
That seems to be, one of the heartbreaking things that I work with, which is, why can't they help? And I go, things just progressed and they waited too long. How long? What time frame is that? Well, 2 weeks, a few months. I couldn't tell you on each individual, but I would say that's probably the biggest reason is that somebody just simply waited too long, put other priorities in play first, and it is going to be an individual treatment plan. I was inside of a facility, and all three ladies with stage 4 breast cancer were on a little bit different, in treatment protocols. One was still very active. She ran multiple miles on a daily basis. The others, they, running was out of the question. But of course, the lady that was doing all the exercise, I think that her body was in just such better physical shape to be able to handle, all the treatment protocols from inside and outside the facility. So you mentioned earlier on, being active, what a difference that can make, and I saw that. I certainly see that on a firsthand basis.
yeah, like there's something about trying to keep the body stronger and resilient. And here's the weird complexity is that, sometimes even inside the cancer might be still growing in somebody, but when you look at them, you can't tell.
Right,
And what I say is that's always on your side regardless, because your body is saying, I'm handling it.
right.
I'm carrying this load. And that means that we have even more room to work with to help you, and time as well. So that's one of the always the keys of keeping people supported and strong throughout any kind of protocol or treatment, whatever they're doing. And then that also opens up, like, say, for those who some people are interested in clinical trials, there's some, well, guess what they do? They cherry pick, right?
Okay.
So the healthier and stronger you are with your disease, they're going to really want you, you
Right.
know. And,
Right. Right.
so it's helpful in many ways, right? It's
Correct.
it's it just keeps those options and doors more open. So again, it's not to say with people who are more more advanced and more, say, frail, there's not things you can't do with them. There always are things you can do. It just becomes more complex, more trickier, right? And it requires more skill levels to try to help them. That's all. And but it's not to say that there aren't groups of patients who can rebound from that. There's some
Right.
that can, and it's like always the million-dollar questions. How do you pick them out? But I've seen enough now in my career that I just it's kind of in another world's hands, and and so you just go for it and help them and customize all these tools and just do your best to also care for them.
There's plenty of hope in there, not to ever use a boxer term, but there's never a reason to be throwing in the towel. So
Yeah.
there's plenty of hope out there. You'll see us. uh I get to hear the success stories on a weekly basis. James, I'm doing better. I stay in contact with everyone, and I like to hear their success stories and how things are going, and which is just great. But there's always a reason out there. So, Doctor, I just got a note here that we're running out of time. So I'm going to kind of conclude with you here today. But it's always just a pleasure of just getting our patients are getting such great information out of our conversations.
It's my pleasure, and thank you as well.
Oh, yes, sir. Thank you very much. We'll talk with you later.
All the best.
I hope you enjoyed the video. If you're in the need of integrative and holistic treatments for you or your family member, please feel free to reach out to us at findhelpforcancer.com. We'll start with a simple conversation and help point you in the right direction. Happy to help.